Good afternoon, everybody. It is a great pleasure to have you all with us today. My name is Kirsty Graham, and I lead the healthcare practice, and I'm also CEO of Edelman's public affairs practice. We're delighted that you're with us today because I think we have a truly terrific panel, and I want to thank the panel in advance for joining us because it's an extraordinary moment to talk about the top issues in healthcare. We're having this conversation in what I think we all know are extraordinary times. We have a historic election next week, and we're in the midst of a global pandemic that has really upended many people's lives and is really laying bare many of the health inequities in our system. So we're going to talk about health equity. We're going to talk about where science sits in the conversation, and we're also going to talk about innovation advancements that are being made for patients, both in the COVID and the non-COVID space. But before getting to that, just a few big picture thoughts. As I look back on the last 8 months, a few things really stand out to me. First of all, at no time, I think, in recent history has this sector been more needed, more valued, and more relevant and more resilient. And I think that applies to people working in healthcare companies, to doctors and scientists who are so incredibly important right now, to the people who are shaping the policy responses to this pandemic, and to the workers, the frontline workers at the front of managing COVID. So it's an extraordinary time for our sector, and I think we are seeing innovation every single day. I think the sector has responded in a way that is truly 24/7, and everybody is doing their part to see what we can do to help. But we also need to be realistic, and we also need to continue to explain our work. People are listening to experts in the sector like never before. Our research shows that doctors and scientists are the most trusted on information around the pandemic. And governments also recognize the expertise of the sector. I think also the ties between having a healthy population and the impact on an economy are also now crystal clear. Without a healthy population, your economy suffers, and the two are inextricably linked. And that is also a segue to, I think, what we're seeing on issues of equity, be it socioeconomic or racial inequity. These issues have now been laid bare, and we will have to address these going forward. When we look at where the burden of COVID is falling, it's disproportionately on those who have fewer resources and fewer choices about where they live, where they work, and what access they have to care. And I think this becomes a greater concern when we hear so much commentary about possibly a K-shaped recovery and whether those disparities will actually widen. I think we're also seeing massive changes in the sector. If we think about how technology, almost 3 years of change that we knew was coming, got squashed into 3 months, how we work, how we engage with our stakeholders, how we reach our communities, that landscape has also changed in ways that were hard to think of in January. And we also know that whether you're a company or an individual, people are thinking far more about the definition of purpose in a truly meaningful way. And trust has become everything. And I just want to give some stats that really underscore that point around trust. As many of you know, we do the annual Edelman Trust Barometer survey. And across the globe, what we saw in the face of the pandemic was the healthcare industry saw the highest increase in trust that we have ever seen. Across the globe, 76% of people said they trusted the industry, and that represented an 8-point jump from January to May this year. And it's not only healthcare that's seen the big improvement, it actually applies to the subsectors within that as well. PhRMA, trusted by 73%, a 15% increase. Biotech, trusted by 71%, a 6% increase. Hospitals, trusted by 81%, an 8% increase. And health insurance companies, trusted by 69%, also saw an increase of 4%. So all eyes are on the sector for a solution, but we also know that is going to be met with an incredible expectation about how do we keep that trust going forward. People are going to be looking at companies about how they behave now and how they behave going forward. And we also know that the elections put further pressure on our industry in this sector. Regardless of the election outcome, the urgency for a COVID-19 vaccine is going to continue. And we're going to need to build trust in its safety across communities around the world. And I think that there will also be pressure on companies to address costs, and that is coming as a conversation across both sides of the aisle. We also know that politics permeates everything, and we did some recent data collection just in the last week, looking at an audit of coverage and conversations across news, blogs, and Twitter, and it was striking how much politics is seen as a threat or a challenge to the longevity of trust in the healthcare industry. So what we know is that going forward, we're going to have to make sure that our partnerships, including with government, are bipartisan, and that we continue to underscore that our work is for the benefit of public health. So I look forward to this conversation today, and I want to now introduce you to Courtney Haupt, who is our US lead for healthcare. Courtney, over to you and to the panel.
Thank you so much, Kirsty. Good afternoon, everyone. I'm Courtney Haupt, and I lead Edelman's healthcare practice here in the US. And I'm so pleased to be joined this afternoon by such an esteemed panel of experts from across the healthcare community. As you see here, we've brought together a really exciting group of leaders with deep expertise across health equity, the pharmaceutical and clinical research sectors, hospitals and health systems, the FDA and regulatory realm, and health media. And our plan for the next hour with all of you is to dig together into some of the biggest issues that those of us who work in healthcare are focused on day in and day out. You know, as Kirsty alluded to, the troubling declines that we see in trust in science and what we can do to rebuild that trust, the national dialogue on health disparities, and the near and long-term solutions that we need to reach those communities who are disproportionately affected by health inequities. And also how we continue to spark innovation in the technologies and treatments to address access gaps, as well as COVID-19 and the range of other diseases and conditions that patients are looking for treatments to. Of course, we do this all with a lens of what we'll see on November 3rd, and also with an eye to what's around the corner come January. We hope this will be a conversation with all of you who are joining us at home as well. And so please know that at the end of our conversation here, we'll have time for a Q&A. There's a chat function at the bottom, the Q&A function with the little talking symbols. So please feel free as the conversation goes on to be sharing questions in there, and we'll be sure to get to that at the end of the chat together today. So let me get started by introducing you to our fantastic group of panelists. I'd like to start with Dr. Uche Blackstock. As the CEO and founder of Advancing Health Equity and associate professor for NYU School of Medicine, Dr. Blackstock has spent much of her career dedicated to advancing equity and justice in healthcare. Featured in the Wall Street Journal, Forbes, and Essence magazine, among other outlets, Dr. Blackstock speaks around the country on issues facing the Black community and mobilizing partnerships to bring solutions forward. So glad you're here with us today.
Thank you for having me.
Thank you. Also with us is Shefali Luthra. As a journalist at the 19th News, which is a nonprofit, nonpartisan newsroom, Shefali closely covers the intersection of healthcare and women, and she's been featured in the Washington Post, CNN Health, and NPR, and was formerly with Kaiser Health News. Welcome.
Thanks for having me.
Also with us today is Piper Nieters-Sue. Specializing in healthcare law and federal policy, Piper serves as the division chair for external relationships at the Mayo Clinic. She's crafted numerous significant policy proposals while serving as legislative counsel for Senator Salazar, including work on the Affordable Care Act. So glad to have you with us.
Thank you.
Reilly is with us as well. As the Chief Operating Officer for the Pharmaceutical Research Manufacturers of America, Lori oversees advocacy and government affairs globally. She's been named the top lobbyist by The Hill for 2 consecutive years, and Lori is known for establishing bipartisan solutions that resonate with policymakers and industry leaders. Lori, so glad to have you with us.
Thank you.
And rounding out this fantastic panel is Dr. Jonca, formerly Assistant Commissioner for the FDA's first Office of Minority Health. Jonca currently serves on CareFirst Blue Cross Blue Shield's Board of Directors and is a practicing physician and ophthalmologist in Washington, D.C. She has clinical experience that spans with roles at Novartis, Genentech, and several medical associations. And she's dedicated her career to advancing equity and a patient-centric approach to clinical trials. Thank you for joining us. So welcome to you all. Let's jump right in. I'll open up the panel with a question for everybody. And I think looking ahead at what we're going to see come the election day and beyond, and based on the experience of where you all sit, and knowing the complexity of the issues that need to be addressed as we look ahead to 2021, where do you want to see the next administration, regardless of the election outcomes, focus their priorities on right away? And Dr. Blackstock, Uche, could we begin with you on that one?
Sure. Again, thank you so much for having me. So, I'm also a practicing clinician, and last March here in New York City, I saw with my own eyes the demographics of my patient population shift from racially and socioeconomically diverse to mostly Black and Brown patients. Many of them were essential workers and service workers. They could not work remotely from home. And as we saw with the data that eventually came out, that there were profound racialized health inequities in the pandemic, not just in New York City, but we've seen it occur across the country, and the rates are just getting absolutely worse. Black, Latinx, and Indigenous communities are being disproportionately impacted. And so I think for me, what I'd like to see is really an equitable allocation of resources to the communities that have been disproportionately impacted the most. And so what that looks like is robust testing and contact tracing in those communities. Another issue that we've seen in Black and Latinx communities is not only have there been significant health consequences, but also a significant number of job losses, small businesses. And so community members need financial assistance in that respect. We need to make sure that there's paid sick leave and that there are protections around health insurance as well. And so I think those are some short-term, as well as ensuring that the institutions in those communities are able to adequately care for the community members. Another thing that we've seen is that there's been even disparate outcomes depending on which hospitals you go to in the pandemic. And so really what we've seen is at sort of every level of healthcare delivery disparities that really need to be addressed in the short term. And then I think in the longer term, we need to address what we call the social determinants of health. So jobs, housing, education, all the factors that we know influence the health of people and communities. And we need policies to address all of those social determinants in order to improve the overall health of our communities. Thank you.
Thank you. And I think we'll come back to that pull through where we're just seeing the impact of disparities across the board as the conversation continues. Lori, how about you? From your vantage point, what do you really see as the priorities?
Yeah, I think I would agree with a lot of what was already said, but I would also highlight, I think, pandemic preparedness. If one thing this entire experience has showed us is that we need to do a lot more to prepare for the next global pandemic. And I think we have ones that are already emerging. When I think about issues like antimicrobial resistance that is gaining traction worldwide, the industry earlier this year made a $1 billion commitment to pool funds together in order to get on top of that growing issue. So I think that's something where Congress could also play a really important role to ensure that the incentives are in place to address some of those crises that before they're actually here in a significant way, as we saw with the pandemic. So that's really the first piece. How do we get on top of being better prepared for the next pandemic, let alone the one that we're in now? I think the other issue, and I would just pick up on the point regarding health equity, and I think that's an area that both Congress needs to work on, and I would say the industry as well. One of the areas that we've been particularly focused on through the COVID crisis is the dramatic need to increase diversity in our clinical trials. I think that has always been a challenge for industry for a lot of reasons. And part of it goes back to trust. And I appreciated that Kirsty started the conversation with one of trust. We have work to do to rebuild trust in minority communities. But I'm encouraged by what I'm seeing happening through COVID research and development. I think it was just last week that Moderna announced that 37% of the volunteers and their vaccine trial were from minorities. Pfizer extended and increased the number of participants in their vaccine trial to ensure they had significant numbers of diverse populations. We're seeing Merck with a therapeutic that is going into communities with higher proportions of minorities to ensure that, again, even when we're making, whether it's a therapeutic or a vaccine, knowing how significantly Black and Brown communities have been hit by COVID, we need to do our part to ensure the vaccines and therapeutics that we bring to market will be not just that they will work for these patient populations, but that they'll be accessible and affordable for them too. So that's another area that I think as we go into next year, that as an industry, we're focused on and hope that we find like minds in Congress to help work on some of those issues as well.
That's great, thank you. Jonca, I wonder, just building on that, both the diversity in clinical trials piece, but also other priorities that you see. Would love to hear your thoughts as well.
Certainly, and delighted to have the opportunity to contribute to this conversation. It's so critical. One of the things that I think was highlighted in Laura's remarks is the level of participation by minorities in the vaccine trials. It is actually a bit of a myth that minorities don't trust clinical trials. There's been research done that has countered that argument. I think certainly the legacy of Tuskegee is still one to be very, very mindful of. But the reality is that we have better protections. It's a tragic legacy, but nevertheless, the institution of institutional review boards and advances in informed consent were some of the constructive things that came out of the tragedies of the Tuskegee experiment. I'd also like to highlight research that was done by Research America that did a survey and found that minority patients, African Americans in particular, were more likely to participate in trials than the white respondents. There was also a meta-analysis done by the Office of Bioethics at NIH that looked at a body of research on participation in clinical trials, and again found that the fundamental reason why minorities weren't in clinical trials was because they weren't asked. So I think what we're seeing now, when there's focus and an aggressive recruitment plan, that investigators are identified that have connections to the minority communities, that those numbers can be significantly improved.
Thank you.
And if I could add.
Yes, of course.
Because I think the question is, why does it matter to have participation? And I'll share with you a question in my earliest days at FDA and leading the Office of Minority Health there. A member of the National Medical Association was speaking at a meeting, and he came to me and said, Jonca, what I want to know is, does this drug work in patients like mine? And I think that's the fundamental question that we all want to know. If you've got a patient in front of you as the physician taking care of that individual, if it's an obese patient, how does it work? If this patient has certain comorbidities, how is this medication going to work? And I think to a significant extent, our research enterprise has not done as good a job as we could have been doing. It should have been done in driving trials that reflect real world people. Mm-hmm. And so that part, I think, is going to be part of this constructive legacy going forward from COVID. Mm-hmm. Because I think the data that we're seeing in the trials for the vaccines is, yes, you can get meaningful numbers in these trials. Yes, you can get patients with relevant comorbidities. Yes, you can go into communities and get patients to participate. And that if the relationship is strong, the trust is strong, the need to participate is made compellingly, we can make this happen. I think it's been demonstrated quite compellingly that that's the case. So thank you.
I think that's a great point. And I definitely want to come back in a little bit and talk more about sort of things that we've seen through COVID that we think really need to be applied and how we do that. I think those points are so important. Piper, I wonder from where you sit, sort of thinking about the hospital, but also the provider lens, like what are the priorities that you see?
Yeah, it's, if I think back to the conversations that I was having around this 1 year ago, this time of year, right? And never would have predicted that I was going to be having a conversation around what the pandemic taught us. So, if we look back a year ago, we were really looking at health reform, right? The next iteration of coverage and affordability and all those concepts was going to be front and center. And so I think, the dialogue that we're having now, those issues haven't fallen away. If anything, the pandemic has really illustrated why it's so critical that we address them in a really meaningful and larger scale way. So I think, Mayo Clinic is an interesting organization in that, we are a healthcare provider and serve 1 million patients every year. But we also invest over $1 trillion in research, right? So it's sort of really looking at things of, from the inception of figuring out what treatments work and who they work for, to really delivering all of those treatments. And so I think, we would be emphasizing things like, to the point that others have made, really looking at how our research infrastructure is built. Is it as inclusive and equitable as it needs to be? And as we look at the diversity of, sort of our country and at an international level, we really need to be serving a different population than we have traditionally thought of oftentimes, when we're thinking about healthcare research and innovation. So I think I would concur with others in terms of the investments and emphasis that needs to be put on, really having equity and diversity in the research side. But I think, we also think a lot about how do you improve access to all populations for the innovative treatments that, you need. And Mayo Clinic tends to be an organization that serves more serious and complex conditions, and really trying to figure out how to connect communities to some of the most advanced medical treatments takes on, a lot of meaning for us. So, we think, about how those health reform conversations, how pandemic conversations really build around care delivery, innovation, virtual care, telehealth, all of those things that really break down the physical barriers that prevent people from receiving care. And, because we tend to draw some patients that come from international environments down to, we have a rural health system in the upper Midwest where we serve sort of very small communities. And all of those individuals have their own access challenges. So I think we would really push on how can we use technology, innovation, and frankly, even new approaches to clinical trials where we're really using, sort of data and artificial intelligence and all those things to make a more robust sort of population pool, and bring all those things together to really tear down some of the barriers that we see to care today, which I think then has sort of a rollover effect of really impacting affordability and accessibility. So, that's a lot to bite off all at once, but I think it's just inevitable that we're going to have to be able to walk and chew gum. We have to be able to address the pandemic while really being able to address our systemic problems as well.
Great points. Shefali, I think sort of rounding it out as you look at everything that you've been covering lately and what you see as priorities and what you're hearing on the ground, what are your thoughts on all of this?
I think Piper's point is really important and well taken, that the pandemic has just sort of exacerbated and put a spotlight on so many existing disparities in our health system that really disproportionately affect women and women of color. And I'm thinking of this woman I interviewed some time ago who is a home care worker, right, which is such an important part of our healthcare system and deeply underserved, right? These are usually women, often women who are Black or brown, often immigrants, paid very little. So this woman was uninsured, undocumented, and she contracted COVID on the job, which often happens because these workers don't get the same level of PPE. And for treatment, she didn't go to a hospital, she didn't go to a doctor because she couldn't afford it. And she stayed home and she gargled hot water and took vitamin C and hoped that she would get better. And luckily she did, but I think that really speaks to the fact that we do live in a system that doesn't give people access to preventive healthcare, to healthcare when they fall sick, and for those who are uninsured, who are undocumented, who in other ways fall through the cracks, access to things like a vaccine, to things like a therapeutic, will remain really spotty even when these treatments emerge, unless we also think about ways to address access and ways to address the sort of the systemic barriers toward getting care that currently exist.
Yeah, what a moving spotlight on just a situation that I think I'm sure you hear about many times in your reporting and that we see constantly.
And
you know,
sorry, one other thing, just if I may,
please,
is that
yeah.
I mean, we spend so much time talking to voters, especially with the election so close, and every woman I've talked to has talked about the importance of being able to afford health care, about concerns about paying for doctor's bills or prescriptions, and the fact that COVID has just done so much for their mental health. And I think that is another emerging crisis. And we need to think big picture that women in particular are really struggling under healthcare affordability and the pandemic. And if they don't see both of those issues addressed in the coming years, I think it'll be a real challenge for women going forward.
Well, I mean, clearly no shortage of issues to be tackling as we look ahead. You know, I wonder as we look at how we tackle these challenges, and I think what you've all laid out, you know, looking at sort of equity in the innovative medicines process and clinical trials, thinking about the mental health situation that I think is something many of us are talking about regularly with the organizations we partner with. And of course, thinking about sort of the cost and access challenges that we hear so much about right now. Many organizations that I work with and that you engage with, you know, they sort of are looking at what is that path forward with solutions. And I do wonder if what any of you see in the work you're doing and the people you're engaging with, you know, are there things that are working right now that we could be replicating more of in terms of examples of sort of those bright spots that could really be pulled through, whether we're looking at health inequities or cost or access, because I think that would be great to sort of hear about what is actually working out there. Dr. Blackstock, I see you nodding your head. I wonder if there's anything you might start with.
Well, actually, I feel like I have to think really hard about that, unfortunately. You know, I think that, you know, because inequities have been exposed by this pandemic, that we're actually pre-existing, right? I mean, there were considerable health inequities, maternal mortality, infant mortality, chronic disease burdens in Black and Brown communities. But I think the fact that we are, and combined with the killings of Black Americans over this year, we're having these conversations about equity and racial justice and in a very candid way that we've never had before, right? So I think this really is an unprecedented moment to think about how, especially within healthcare, how can we move forward? And I think when you bring up these issues of trust, right? And saying that, you know, right now the trust is at an all-time high for the healthcare sector. I think we can really try to take advantage of that. And what I see, especially in thinking about the vaccine, and Dr. Bull mentioned this, but thinking about how to form relationships with community-based organizations, community partners, I think, especially in terms of the vaccine, outreach and messaging is going to be absolutely crucial, right? And so it's going to be about engaging with churches, neighborhood coalitions, like YMCAs, right? You know, trusted leaders and organizations within the community, even utilizing community health workers who are really incredibly invaluable and may not have the privileged status of physicians and nurses, but typically come from the neighborhoods or are familiar with the communities that they serve. And so it's really going to be about healthcare organizations taking a very innovative and forward-thinking approach about what community engagement looks like. And what I see happening now is these, especially in terms of who organizations that I've been working with. I've been working with health startups, pharmaceutical companies, and they are having these conversations because it's just so important to really center the communities for which you're providing care.
I do think this conversation around that hyper local community engagement and the need to really look at tailored approaches, not just sort of a blanket message, but really thinking about how you get in there and who you need to be engaging with in different ways so that that trusted message gets through is something I'm hearing so much more about from many people across the community.
Yeah, I would agree with that. I mean, I think that, to be clear, pandemic is an incredible tragedy and something that none of us would have ever, wished to happen. But there are, I think there are some silver linings in this. And for us, one of the things that's emerged is that we are building relationships with community partners who we, previously have not had close affiliations, and really beginning to understand their needs at a much more granular level. So I give the example sometimes, like for instance, one of the things that Mayo Clinic has done in our communities very robustly is provide COVID-19 testing, right? And having testing available. And so in Minnesota and Arizona, we early on fostered a partnership with the 18 tribal nations to make sure that, we were being able to get testing to those communities, and not just through Mayo Clinic coming in and providing that testing, but really training people in those communities on how do you perform a test, how do you make this accessible and make it self-sustainable. And so, we're still very much in the throes of the pandemic, but already having conversations about, okay, in the course of this, we now recognize that they've got these 12 other needs where we might be able to help a little bit. And so how do we start expanding that training and those relationships to really get at some of those bigger issues? So I think to Dr. Blackstock's point, there's a real opportunity, if we seize upon it here, to continue some of these unique partnerships in a much broader fashion. But it's also really easy to fall back into old bad habits. And so we have to make a very concerted effort to keep that moving forward and not just, sort of rubber band back to what we're used to.
And Courtney, if maybe I
yes, please,
add a point too, if we're looking for bright spots, one that I've seen within our industry is just I would say in some ways, unprecedented level of collaboration that is happening. And that's happening at a lot of different levels, both between large and small companies, industry with academia, industry with FDA, BARDA, NIH, on the clinical trial front, and Piper and Dr. Blackstock alluded to this too, but a lot more recognition that some of the partnerships that need to be built, particularly with HBCUs and others, if we're going to rebuild some of the trust that needs to happen. So I'm encouraged, at least by that, representing an industry of competitors, and there's a recognition amongst folks in our industry that working together is the only way we're going to get around and solve this pandemic, and seeing companies offering manufacturing assistance to say, if you're the one that succeeds, we will help manufacture that product so that we can have it in time. And that, I hope a lot of that stays, because I think we advance science much quicker that way. And again, it is an industry of competitors, but I think as it relates to COVID, I've seen much more collaboration and cooperation. And I've heard from our leaders that has been a very big bright spot, and one that we hope continues well past the pandemic.
I would echo that. That's a place I hear so much on right now, is just there is a positive energy, seeing so much collaboration in unexpected places from organizations and companies that are either competitors or ones who are in completely different spaces who have come together. And I think there's a lot of question about how do you harness that and keep it going, once we are through this or into the even newer new normal. Dr. Jonca, when we look at sort of the agency perspective, do you think there's pieces there, either from the FDA or just from the way people will engage moving forward, to keep that kind of spirit of not just collaboration, but even the accelerated treatment and the expectations that we've now seen of, well, you can do it faster. How do we continue that without, and still addressing the concerns that it's being done with all of the right scientific rigor and processes in place?
I think it's challenging because they're standards, and standards exist for a reason. And typically, when you look at the history of medical product regulation in the United States and globally as well, there was usually some tragedy that happened that required those changes to occur. I'd like to highlight, though, that awareness of health disparities is not a brand new concept. Going back at least to 1985, under a Republican administration, when the Secretary's report on Black and minority health was issued, there had been a large study looking at public health indices in the United States, and they ended up having to do a separate report because the disparities in Black and minority populations were so striking. And remember, I said 1985, okay? Mm-hmm. So we can fast forward to 2003, and the Institute of Medicine, groundbreaking report, Unequal Treatment, that was issued, again, highlighting the science around and the demographics around health disparities. That was 2003, okay? So here we are now, and I think the thing that was probably most troubling as the data around COVID evolved and populations that were experiencing disparate impact were not surprising, because we already knew that there were disparities in respiratory diseases in communities where the air is poor, where living conditions are suboptimal, that obesity, that pre-existing diabetes and hypertension, cardiovascular disease would indeed lead to worse outcomes. And our outcomes have mirrored data that we already knew existed. So I think we have opportunity in this crisis to harness this. I would like to also reference Dr. Blackstock's earlier reference to the social determinants of health, because we've got to address issues around access to healthcare. We've got to address living conditions. We've got to address the very difficult issue of structural institutional racism if we're really going to come out of this stronger as a nation. I think the other searing fact around this pandemic is that we have to exist as a community. When you're dealing with a highly contagious disease, it's not something that you can isolate behind a wall community. So we've really got to pull together, because we're all literally in this together.
And I think as you were talking, what was really top of mind for me is that as we are looking at health disparities, and I think the increased awareness and conversation we are seeing nationally, this is something that has to be addressed. At the same time, we're seeing this increase in distrust in science and questions about sort of the public health imperatives that we've all, I think, in healthcare community held so strong for so long. And I think as we look at both of these coming together and sort of what do we do, the question I'm hearing a lot from the organizations I'm working with is, what are the best approaches to actually make sure that we are, reestablishing faith in science and facts. At the same time, we're keeping in mind that we might need to do this in slightly different ways for different communities. And I'd love any thoughts that you have on either things that you're already seeing in practice, or just the things that we need to be doing to put into action to make sure that we are reestablishing that trust in science.
I think it's a great question, because I do think it's a challenge. I will say on one hand, there is a desire for the industry to move and to move quickly, as Dr. Bull said, but there are standards in place for a reason. And I think some of the actions that our members have taken to try and ensure that there is trust is one, the vaccine makers came together and announced a pledge that they would not move forward and seek regulatory review until, phase 3 rigorous trials had been completed, because they want to ensure, obviously, that the products they make are safe and effective, but that there's also trust in the community to use them. And I think there is this, desire, and politics has entered into this. And I think that has caused some hesitancy. We're seeing that now is several states, I think it's up to 3 or 4 states who are saying, well, we want to also review in addition to the FDA, which is really unprecedented. So that is worrisome. I would say a number of our companies have also said, we're going to be transparent about the protocols that we go, that we're using, again, in order to try and say, we don't want to hide things here. We want to be transparent. We want to be open. We want to build confidence in the system. And again, the speed at which companies are working, trying to reiterate to the public that it isn't about cutting corners, because we can't cut corners. They are doing some processes at the same time that may have subsequently been done, one after another, because they're trying to be ready. Manufacturing is a great example. You've got companies now that are manufacturing at risk, meaning they're making their vaccine in anticipation that it gets approved. It's possible it doesn't get approved, but if we wait for the approval, that will delay the time it takes to be able to distribute those vaccines. So I think there is worry. All the polling indicates, as time has gone on, confidence about vaccines has declined, which I think is unfortunate. part of that, I think, is just the political environment that we're in right now, and that the issue around COVID has become a bit of a political issue. I think as an industry, we're trying to stay out of that fray, trying to reassure the American people that we stand by the products we make. We're doing everything we can to ensure the safety and efficacy of our products, but we need to do our part to build trust as well and continue to build trust with the American people. Otherwise, it can create devastating effects. If at the end of the day we have vaccines and people aren't willing to take them, we're not going to get out of this anytime soon.
I have a few comments, and I would say even myself as a practicing clinician never realized until this moment of the last few months how important health communication was, and how important it was for the public to hear from public health experts and physicians on the ground caring for patients, and how important our voices were in this moment, especially in terms of trust. And that's one of the reasons why I also do media work, because I think it's important for people, especially from communities of color, to see someone like me, right, who takes care of patients, but also works with organizations to address health equity, on air talking about these issues. And acknowledging that they're there, but also acknowledging that when there is a safe and effective vaccine, that it's so incredibly important that communities of color especially will be willing to take it. I also wanted to mention that the National Medical Association, which is the oldest and largest organization for Black doctors, actually a few weeks ago has organized a task force that will actually be vetting FDA recommendations around therapeutics and vaccines. And so that organization is, it's led by Black physicians. And I think that, those kind of collaborations will be incredibly important in gaining the public's trust. I think also the president and CEO of Meharry Medical Center, which is a historically Black college and university, he also has enrolled as a participant in the vaccine trial, right? And HBCUs, as Lori mentioned, are engaging in the clinical trials and encouraging staff and students and faculty to also participate in those trials. And so I haven't seen anything like that before. It's so incredibly important that trusted leaders are becoming involved in this process to gain trust from the public.
If I could jump in as well, I think what Dr. Blackstock and Lori have both been getting at is really important, right? That, I am not a corporate communications expert, but people respond well to science. There's a reason that so many Americans trust Tony Fauci, of all people, right? They see him as this really nonpartisan, by the book speaker of facts. And it seems that it's really important to be upfront and thorough and clear, and to elevate the voices of experts. And I think one area that's been really, really challenging has been communicating to the public, right, how scientific knowledge is developed, right? We learn things slowly, we accumulate more evidence, our priors change, and making that nuance come across seems really important to me. The other thing I think is an important lesson from all of this is this isn't the first or the last time that we've seen politics really enter scientific discourse in a way that's detrimental to public health. And I think we should probably take a look at the experience of COVID and research and vaccines, and think about issues like climate change, where there has been such a political conversation around things that are really undisputed by those who know the subject matter, and take steps to make sure that this sort of misinformation doesn't occur again.
I want to take in a couple questions that are coming in from our audience, and I think build very nicely on sort of where we've been talking about. Here's the first one. Because of COVID, many people are interacting with the health system in ways they might not have before, from telemedicine to navigating their insurance policies, and for some, even navigating hospital systems. How do you see this impacting trust in healthcare moving forward? And I think a piece there I'm really interested in is sort of the conversation we've been having about technology, and really how, the accelerated adoption of different kinds of of health tech options, including telemedicine, but other ways, like, is that feeding into ways that will really help to increase trust as well as access?
I could start.
Oh, no, go ahead.
Go ahead.
Oh, you're fine,
Okay.
Dr. Go. Yeah.
Okay. I think one of the challenges is going to be access to access, in that insurability, having insurance. There certainly have been examples publicized of folks who did not have health insurance, who, because of COVID, had to seek care and have experienced significant healthcare bills. There's also speculation that there now are hospitals, because the impact of COVID on their bottom line has been so significant, that that there's a different kind of triage of patients. I think we've really got to look very closely at how access is managed, how access to these therapeutics as they are approved will be handled, and that we're doing our best to do right by our communities, by all of our citizens. So,
Thank
Yeah,
you, Piper.
I would build on that and say, I mean, I think the opportunity in the pandemic, and this is not by any means unique to us, was that it really forced us out of our comfort zones into areas where we had to sort of trust and embrace things that previously people perhaps had been hesitant, to explore. And I think one of the best examples of that is telehealth and virtual care, where you still have access issues, to Jonca's point around broadband, and, do people even have reliable internet service, right? So there are some basics that we're still trying to address, but there was, prior to the pandemic, I think we had really been looking at virtual care specifically in the context of rural health, and ensuring that, as populations and people really are moving in different ways in communities, how do you maintain access if you're not going to be able to have a clinic in every town? And the concern was always that the acceptance and trust of something like virtual care wouldn't be there right away in the community. And what we saw with the pandemic is, just like, every other provider, the number of virtual care visits that we were providing increased 3,000% over the course of 2 weeks. And so now we have, sort of a robust portion of our care that's done virtually, and a much greater acceptance of that type of an interaction, and the things that previously had held people back, both in terms of, needing to try something different and privacy concerns and all of those things, have somewhat been mitigated by actually being forced to experience it. And so I think that's just the beginning. But again, it's really on us to figure out, how do we translate that into something that's sustainable, and maintain that trust, because in a lot of circumstances, people were open to that because it was their only option, right? And now we need to make sure that it remains an appealing option. And in many cases, I think, can get at some of these access and affordability issues that, we've largely been unsuccessful in addressing. But, the regulatory environment, all of the other privacy environments, the data environment, all of those things have to come together and move with it. And that's not always an easy thing to do.
As a follow-up on that point,
Courtney,
please go ahead. Yes,
I just wanted to make, and I'm just thinking about sort of equity, actually, when it comes to telehealth, and Dr. Bull, alluded to this in terms of this broadband access gap that is present in this country, but also thinking about how technology is not necessarily always can be used in positive ways. And I just say that because there are language barriers, depending on the educational background of the patient. A text visit with a provider may be a challenge for them, or a conversation over the phone. And so when we're thinking about these services that permit wider access, we also have to make sure that there is not bias embedded in these processes and in this technology as well. So I just wanted to mention that.
Oh, I think it's a really fascinating place to be digging more into. Along the lines also of sort of, where technology has, either shortfalls or challenges, there's a big conversation, I think, to be had about, the human face of healthcare, and that while the accessibility to expand it with telehealth and other technology has been such a great thing for people to be able to access who can. You know, as we look ahead, how do we really make sure that patients still feel that personal touch in healthcare with a physician they trust, you know, in person? And what does that sort of balance between the two as we look at sort of how things shape out in the future play out? And I wonder if any of you have thought sort of on that balance of sort of where telehealth and the technology goes. At the same time, we want to make sure people feel, you know, that ability to personally see their physicians and others.
Yeah, I would say that I think I mean, you really have to have a mix of both, right? So, you know, maybe your first visit with your physician or your provider is an in-person visit, and subsequent visits are, you know, a telehealth or a virtual care visit. I don't think telehealth or virtual care is ever going to be able to replace, you know, sort of in-person care or a human connection. I think we really have to view it as complementary and supplemental. But, you know, in some cases, can you replace an in-person visit comfortably with a virtual care visit? Absolutely. And, you know, for many people who have barriers to care, like transportation or taking time off work or being able to afford a visit, this is a real solution. So, you know, I think it comes with challenges. But, you know, even today's discussion on Zoom, right? It's amazing how much we can acclimate to having personal connections with people, even when we can't be in the same room together. And, you know, I think if anything, the pandemic has really taught us to be creative about how we build those relationships. And that can really pay off in spades if we embrace it in the right way.
So true that we've all been able to adapt and find ways through to still be engaged and creative despite the barriers of the distance. One more question that's come in that I'd love all of your thoughts on as we sort of near to the close of our conversation from the audience. In media coverage that we've seen, healthcare companies and the government often appear to be at odds with each other, particularly over pricing issues. But we also know that there are healthcare and government partnerships that are working well. What can health companies learn from these partnerships? And I think both sort of the partnership piece there and what we can learn, but I also think, you know, Shefali, I'd love your thoughts just on sort of the conversation that you're seeing play out with you and maybe other colleagues across the healthcare media, and sort of how you see the story covered between sort of healthcare and that government intersection.
Yeah, I think that's really interesting because, I mean, this is sort of what we got to earlier, right, is that the process of developing vaccines and therapeutics has been unprecedented collaboration between government agencies and industry. And I think that this sort of argument of a simple conflict narrative may have felt applicable prior to the pandemic, but it definitely is not the way I think a lot of healthcare journalists would see the story of the past 8 months or so. And I would love to hear Lori's thoughts on that too, because I think you'll know a lot on this.
Yeah, I would say, and we talked about it earlier, the unprecedented level of collaboration. I mean, our industry leaders are having weekly conversations with folks at the Food and Drug Administration, 1 week on therapeutics, the next week on vaccines. And those conversations are happening with BARDA and NIH and all of the government entities, CDC, involved in the effort. And I think you would hear universal accolades from our industry about the level of cooperation and collaboration that has existed. And I think, I think you've started it, you or Kirsty started the conversation with how do we keep harnessing that? How do we take those learnings and say, there's a lot of problems we can solve when our attitude is one of collaboration and cooperation. And how do we keep this momentum going and take the learnings from this and transfer it to other disease states? Because whether it's the pandemic, there's lots of other, and we talked about it a lot here, there's a lot of other issues that are have bubbled up closer to the surface as a result of COVID and that merit the same level of vigor and interest and collaboration. And my hope is that we take what we've learned over the past 8 or 9 months and that we keep a lot of those going, because I do believe we're stronger together. And when we work together, that's when the best things happen. And that's when the science will win at the end of the day.
Well said. Any other thoughts from the panel, sort of building on that, just in terms of collaboration and partnership?
Well, I can say, I mean, we've had the exact same experience during the pandemic, that relationships that perhaps were always portrayed as being adversarial or somehow in tension, and frankly never really were. I mean, this partnership to some degree has always existed, perhaps not quite at the degree of visibility and effectiveness as it is now in this circumstance. But I think of the early days of COVID. Mayo was one of the early organizations that had a test available for COVID-19, had started working on that really at the beginning of February. So by early March, we were ready to go. And we were in a situation where all the states around us, not just Minnesota, but really lacking testing at a time that we were having surges where it was critically important. And so, over the course of, one day of phone calls, we would find, we were offering testing to, the state of Colorado, or we're offering it in Wisconsin. And things that would normally take months to have happen, in a period of desperation and really trying to get people the things that they needed, could happen in the course of 4 hours of just really efficient phone calls, right? And so you'd like to see some of that continue. Now, it's never going to be the same outside of a very, sort of valid crisis environment. And I'm not saying it's always safe that some of the things that we have in place are bypassed, but that's sort of a cost benefit balance that everybody makes. But I really do think, again, it's a broadened network of the people who are working together, and then, a broader opportunity of the things that you can work together on. And that's something that I think is really promising moving forward. Honestly, not just in the broader scope of healthcare, but as we face the next wave of this pandemic, because what we're seeing is that, to the extent that we thought we were coming to the tail end of it, it's really anything but.
Well, thank you all. I wanted to thank you all for joining us today. I'd love to bring Kirsty Graham back in to share some final thoughts with us. Kirsty.
So thank you, Courtney. And I just want to thank you all. I thought that was an incredibly thought-provoking, you covered so much territory, and the generosity of your bringing your individual experiences of the work you do in the workplaces and the type of interactions that you have had in your roles in the last 8 months. I just thought that was amazing. I think that when I reflect on what we covered in the last hour, we need to sort of recognize this moment of profound upheaval, profound loss, profound change. And I think the point around mental health is absolutely right. And use our relationships and our experiences, be they in government or in the media or NGOs or in business, to say, how do we make this better? What do we learn from this? How do we take some of the issues that we are now dealing with and make our approach to them more candid? And I like the word I heard a couple of times, sort of around a reset. And when I reflected on what you've all said, there were a few bright spots. So I heard, it's true, the unprecedented level of collaboration, the candor of conversations around disparities, including issues like addressing living conditions, like addressing structural racism, the recognition of who are the influencers in the community, including church leaders, who is helping shape these conversations. The conversation also around preparedness and prevention. I think that's a really interesting call out, both on antimicrobial resistance and even as we look at climate change. There are some learnings from preparedness around this pandemic. And then the recognition that we're looking for treatments that don't just work, but they've got to be accepted by people, they've got to be affordable, and they've got to be accessible. And my own personal bright spot that I hope in a reset is that the health of a nation becomes viewed as an asset, not just as a cost. And so I would like people to go away and reflect on this conversation and think about all the contributions that you have made and where we all sit in our workplace to how do we make things better. Trust has got to underpin everything we do. The point made around the moment in time right now for the importance of healthcare communications and communicators, and that people respond to science. So I just want to thank you all for an amazing conversation and for your generosity in sharing your experiences. So thank you all for joining us, and stay well.
Thank you.
Thank you. Thank you.
Thank you.